The cardiac action potential is defined as the change in the membrane potential of cardiac cells. This is caused by the movements of ions between the inside and outside of cardiac cells through their membrane ion channels. The action potential in cardiac non-pacemaker cells differs from that in cardiac pacemaker cells. The action potential in non-pacemaker cells has 5 phases. The resting membrane potential in non-pacemaker cells like ventricular cells is around -90 millivolts. This is close to the equilibrium potential of potassium ions. The resting potential is generated mainly due to the outward leak of potassium ions, which is controlled by inward rectifier potassium channels. Sodium-potassium pump and sodium-calcium exchanger also play a role in maintaining the resting potential of the cell membrane. Phase 0 begins with an increase in the cell membrane voltage. When the membrane voltage reaches -70 millivolts, called the threshold, it causes the opening of fast sodium channels and the entry of sodium ions into the cell. This depolarizes the cell membrane. The entry of calcium ions into the cell through the L-type calcium channels plays a lesser role in membrane depolarization. Non-pacemaker cells have rapid depolarization. The action potential in these cells is called fast response action potential. In phase 1 or early rapid repolarization, which follows phase 0, sodium channels become rapidly inactivated and the flow of sodium ions decreases. Moreover, voltage-dependent potassium channels open rapidly and potassium ions leave the cell. The cell membrane potential becomes temporarily and rapidly negative and reaches almost 0 millivolts. In phase 2 or the plateau phase, potassium ions leave the cell through delayed rectifier potassium channels, while calcium ions enter the cell through L-type calcium channels that were activated in phase 0. At this stage, the inward flow of ions is almost equal to the outward flow of ions, so the membrane potential remains almost constant. In phase 3, L-type calcium channels begin to close. Also, slow delayed rectifier potassium channels and rapid delayed rectifier potassium channels open, and potassium ions leave the cell. Finally, the cell membrane becomes repolarized and its potential reaches -90 millivolts. The flow of potassium ions through inward rectifier potassium channels continues until phase 4. Sodium-potassium pump and sodium-calcium exchanger are also active in this phase to bring the membrane potential to the resting state. The action potential in pacemaker cells has 3 phases. Pacemaker cells like the sinoatrial node have unstable resting membrane potential, so they can spontaneously generate an action potential. In phase 4, the inward flow of sodium ions called funny sodium currents through the HCN channels increases the membrane potential in the sinoatrial node. When the cell membrane voltage reaches approximately -50 millivolts, T-type calcium channels open and calcium ions enter the cell. After that, at a voltage of around -40 millivolts, L-type calcium channels open slowly, calcium ions enter the cell, and the cell membrane becomes slowly depolarized. The action potential generated in these cells is called slow response action potential. At peak, L-type calcium channels become inactive and closed, and calcium ions no longer enter the cell. In addition, voltage-gated potassium channels open and potassium ions leave the cell. This repolarizes the cell membrane. The action potential in cardiac cells differs from that in other excitable cells such as nerves. The duration of the action potential in cardiac cells is longer than that in nerve and muscle cells. In nerve and muscle cells, the action potential is generated due to the opening of fast sodium channels, and the influx of sodium ions depolarizes the cell membrane. While in pacemaker cells, the flow of calcium ions plays an important role in depolarization.